Geistlich has been around a long time, and I think the products are very proven, and there's a lot of data and research to back that up. So my name is David Urbanek. I am an oral and maxillofacial surgeon. I practice in the greater St. Louis area. I did my undergraduate degree at Case Western Reserve University. Afterwards, I pursued a Master's of Science in Applied Anatomy at the Case School of Medicine. After that, I went on to dental school at the Case School of Dental Medicine and got my DMD. My experience with the Geistlich products has been always about quality, and it's significantly better quality than the other products that I've used. The indications that I use Geistlich products are variable. So I will use it for soft tissue augmentation when I use Fibro-Gide to augment the facial soft tissue around anterior implants. I will also use Bio-Oss when I'm augmenting bony defects. I like to use Bio-Oss Collagen as well. I use those specifically to graft that facial gap between the implant platform and the facial cortical plate when I do anterior implants, anterior immediate implants. The reason I like Bio-Oss Collagen so much for my immediate implant placement is, one, that it's stable, so when I place it, it's 90% Bio-Oss, so it's going to stick around and I know it's going to be there for a while. And then the other reason I like it is it's 10% collagen, so it has very good handling characteristics. A lot of times when we're placing particulate bone graft, it's like herding cats. You're trying to push the graft all over and it's ungainly, it gets all over the place. But what's nice about the Bio-Oss Collagen, I hydrate it and then I can kind of like smash it a bit and I can push it in to where I need it to place it, and it just has great handling characteristics. So it's kind of like the best of both worlds. As for having success with immediate implant placement, it all comes down to proper planning and selection of the right materials. I found that when you have more bone and more soft tissue thickness, and the studies back this up, you're going to have better long-term results. So what I like to use is Bio-Oss Collagen to graft the jumping gap, and then I also like to augment the facial soft tissue with Fibro-Gide. And what's nice about using the Fibro-Gide as opposed to autogenous connective tissue grafts is you don't have that donor site. You don't have that donor site morbidity, the extra pain, the extra cost. Basically, you take this off the shelf and then you can implant it into the patient, and I've gotten great results with it. Another product that I really like using is the Exos custom titanium mesh. I love that because it's custom. It just fits beautifully and it just clicks right into place, and there's a lower chance of mucosal dehiscence and perforation and membrane exposure with those because it is custom. So with the Exos mesh membrane, I found it's very easy to click in. It just fits perfectly. Also, removal was very simple as well. Found that the bone grafting results were phenomenal. I used a combination of Val-Oss demineralized cortical fibers mixed with Bio-Oss xenograft. And the reason I like that is it has a lot of growth factors in those demineralized cortical fibers, and it really allows the quick bone growth, but also there's stability built in with the Bio-Oss particles. It's definitely important to bone graft, and I like to bone graft because I want to preserve the bony architecture that's there, and you can never predict how difficult the case is going to be when you're going to remove that tooth, because you're going to be left with a bony defect sometimes, or maybe there's some pathology there that you didn't quite pick up on the pano, and all of a sudden the tooth's out, and now you have this big defect that you weren't planning on grafting, you didn't consent the patient for, you didn't collect for, and then now you have to have that conversation with them on the back end or so. So I always like to plan on bone grafting ahead of time to prevent those issues. Failures can be tough and disheartening and costly, so the way I try to prevent that and mitigate that is to do proper planning on the front end, proper grafting of the bone and soft tissue, and then always choosing the best materials. Advice I would have for residents that are just getting out of their programs is to keep your mind open. In residency, we are very well trained in certain things. We're also limited in our training in other facets. And so just keeping an open mind to new products, new procedures, different ways to do things is going to be very important.